Hi guys, it's me. I just wanted to do a follow-up about my thyroid surgery. I just passed my 2-week mark and I just wanted to show how my neck looks and just to say how I'm feeling. So the doctor took the stitches out I think yesterday or the day before. Yeah, the day before yesterday. And so I'm feeling better. My throat is healed up from the breathing tube because it hurt for a long time. And my scar, well, my scar will be there for a while healing up. It's only been 2 weeks, but it looks pretty good. Anyways, yeah, so that's it. This is 2 weeks after surgery. There's nothing open there. Like, the stitches are out, the wound has closed up together, so it's more now of a scar healing. This right here is still a little bit numb. Like, it still feels like the nerves there are, they're not connected properly, so they still feel like this whole area right here feels numb. So hopefully in a couple weeks that will go away. But that's it. So that's now I'm able to go back to work as usual. I feel tired, but I've been taking my Synthroid for the past 2 weeks, and I'm going to be going in for blood work in a month to see if I need to take more or less of it, or how it's going. So until then, I will just continue to take the prescribed dose, and then I'll have my first blood work done to see how it's working. So I feel really tired, like way more tired than normal. So it's going to take me some time my body to get used to not having the thyroid, I think. But I feel optimistic, and so I'm going to stick with that. So I don't want to think that maybe it was a mistake to have it out because I feel so tired. I'm just going to be optimistic and try to get as much exercise as I can. So in 2 days, I'm starting my own personal 100-day challenge, and it's just 100 days of me really focusing on what I'm eating and how much exercise I'm getting. So it's nothing specific, but because I also do have type 2 diabetes, I'll be eating low carb, because if I eat a lot of carbs, my blood sugar goes really high, even with the metformin. So I will be eating low carb and trying to get some walking. There's not a lot of exercise I can do besides walking, and because my heart rate is still pretty high from the thyroid situation. So if I didn't mention before, I have Graves' disease, so if anybody knows about Graves' disease, you know that your heart rate can be quite high, and the surgery was supposed to really help with that, and it did for the first day. My heart rate went down to like 65 beats per minute, but then after a couple of days it went back up to about 90, and it's still better than it was before. Normally it's about 105, 110. So the fact that it's 90 means that it is getting better. And then my resting heart rate, like when I'm sleeping and I just wake up, it's pretty good. It's about 75, 80. So all in all, it's gone down quite a bit, but I hope it will keep going down. So for now, I will just be doing some walking, and I will talk to my doctor about whether or not I still be taking the beta blockers for my heart. So anyways, so that's it. This is 2 weeks in, and like I said, in 2 days I'll be starting a 100-day fit challenge, just a personal thing that I'm doing, and I will be posting about that as well. Okay, take care.